Thank you very much. My name is Naoki Hayakawa, Asahi General Hospital, Japan. It's great honor for me to be here. And today's my topics is the LINC 2025 the EU study. We presented, and EU study conducted a 3-year detailed drug-related balloon treatment for Femoropopliteal CTO. We have many accumulated experience in successfully treating even FP CTO with DCBs. However, many clinical studies performed DCB with bailout stent. So our clinical question is DCB strategy for femoropopliteal CTO feasible? This is a unmet needs of the FP CTO region. We conducted this study from by our Japanese Eastern Japan, Eastern Japanese and 7 cardiovascular centers, B-STARS registry, and we conducted multi-center non-randomized study, examined 359 consecutive lesions and 318 patients with symptomatic femoropopliteal chronic occlusion lesions treated with drug-related balloon from April 2017 to February 2021. And a 12 months clinical outcome of EU study we already published. And from this study, the 12-month primary patency was about 80%. And the 12 months freedom from CDTLR was about 86%. And the freedom from reocclusion was 88%. Very acceptable. However, we analyzed based on the accumulation of the restenosis risk factors. From these studies, the independent risk factors for the patency loss was 4 factors: hemodialysis patient, CLTI patient, and restenotic lesions, and no use of DAPT dual antiplatelet therapy. If there are no factor patient, 12 months primary patency was 90%. However, the more factor means over 2 factors patient. 12 months primary patency was 66%. So this study we conducted 3 years. The purpose of the 3 years follow-up study was to present clinical outcomes and the results stratified by each risk factor of the 12-month restenosis. From this study, the 3 months primary patency was about 52%, and the 3 years freedom from CDTL was about 62%. And the 3 years clinical outcome was based on the accumulation of the restenosis risk factors. The no factor patient, 3 years primary patency was over 65%. However, the more factor patient, the primary patency was under 30%. And the TLR components, the 65% was the balloon angioplasty and the 59% was DCB angioplasty. However, the 32% was a scaffold device using, and however, surgical conversion was only 1.6%. And 3 years freedom from reocclusion and freedom from ALI was a very high rate. The reocclusion was 77% and the freedom from ALI was 96%. So the clinical results of DCB for FP CTO were in the feasible range. However, the 3-year patency was low in patients with many risk factors. The risk factor means the CLTI, hemodialysis, and the restenotic lesion, and no DAPT use patient. And the patient without restenosis factors at 1 year could achieve acceptable 3-year patency. And the acceptable 3-year clinical outcome for freedom from CDTLR and reocclusion and ALI. So we conducted this study and the beginning of the use of DCB in Japan. And the atherectomy device was not used during this study period. So it is possible that the techniques used to improve the result of DCB were still immature. So it is necessary to conduct further larger scale, up-to-date technique and up-to-date research in the future. So thank you for your kind attention.